Hello everyone, welcome to Move Well, Live Well. We've been having a number of people coming in with problems with their hip, and specifically they're having problems with externally rotating their hip. This is external rotation of the hip. This is external rotation of the hip. This is internal rotation of the hip. So what's happening is having problems with external rotation of the hip, and they're getting tightness and discomfort in the hip. And what's happening, you sometimes even pain going down the side of their leg, front of the thigh, even going down into their calf. And so again, we're finding a lot of these people that do a lot of sitting as their profession. They're either on a computer or they do a lot of driving, and they're getting problems with their hip and with issues with external rotation. So they're having problems with doing this. They're missing that. One easy fix to fix that would be a kind of a weird stretch, and a lot of people don't do this particular stretch for the hip. It's called the frog stretch, and simply you kind of get into, let me show you how to do this here. With the frog stretch, you're going to be going into, this is abduction, hip abduction, so you're as wide as you can go comfortably. I'm doing this in jeans because that's just the kind of guy I am. So we're going to do this as wide as you can go. This is hip abduction. And then you're going to be moving back and forth in this position here. So you're going to go forward. And you're going to sit backward into this until you feel that tightness into the capsule and that hip joint itself. Again, this shouldn't be painful. You should just feel a nice tightness in through there. A little bit of discomfort is okay, but you're going this nice and slow. And so again, you're going to do as wide as you can go, and then you're kind of just rocking back and forth in this position to open up the hip complex. Side view, you're going to be here. Again, you're going to go wide. You're going to open up the hips as wide as they go here, to your comfort level. And then you're going to rock back and forth. So you're going to go forward. There's a better side view. There we go. And go forward here. And then you're going to come backward. Just like that. And you may even get a little bit of a soft tissue endpoint here where you can't really go much farther. And that's okay. You just stop where you feel comfortable. You can even do a contract relax where you can kind of push with your knees. You're pushing down into the ground with your knees. Just 1, 2, 3. And you can find you get a little bit more range in here. And you can just kind of rock back and forth just gently, just like that, to open up the hip complex. This is not a normal hip stretch. Most hip stretches put you into a general hip external rotation. This is hip external rotation with abduction. It really helps open up the front. The medial parts of your hip, the inner thigh, if you will. So again, you're rocking back and forth. And again, you can push down into the mat or the floor with your knees. Squeeze 1, 2, 3, and you can kind of get a little bit more range by doing that. Push down into the floor and get a little bit more range in here, just like that. You can see I'm keeping my back from extending. I'm not, going to extension or anything like that. I'm keeping my back fairly neutral as I'm doing this. Good. So work that 3 to 5 minutes. That'll help help open up that hip and get you more into external rotation of the hip. Kind of test it now. You got a little bit more options when you can go into external rotation of the hip, and it's less tight for you when you're sitting there or you're driving for long periods of time. If you have any questions with this particular mobility or stretch, feel free to drop them off in the comments. We thank you for watching. We appreciate it. Please like, subscribe, and share. And when you hit subscribe, just hit that notifications button real quick so that way you don't miss any of the videos that are coming into your box. Anyway, thanks again. We appreciate it. We'll talk to you soon. Take care. Bye-bye.